when we talk about heart and such things as stress, anxiety, depression, they are so closely linked, and that has had a tremendous impact here. And of course, Emily knows that now, and her doctors have told her that. But that's true with everybody, correct?
Absolutely. And I'm not sure how much the doctors really have told you, because as we've talked about, many doctors don't focus on the role of our emotions, the role of our stress, and how it really impacts the heart.
Jeff, you say you weren't surprised when she had a stress-related heart attack because you see how tightly wound she is.
She's been like this ever since I've known her, which is almost 25 years. She's tightly wound. She can have fun, but I don't know if she's relaxing, and it's wearing you out.
You're wanting to be perfectionistic, and in fact, you're out of control, not in control, because you're not paddling your own canoe. You're just responding to what everybody, phone rings, you answer it, get it done, phone rings, answer it, get it done, phone rings, answer it, get it done, instead of being the captain of your own ship here. And if you were truly in control, you would have a balance of health, recreation, work, stress, achievement, all of those things. And that's what you're going to have for longevity, and you can have that. And you can reset your stress levels throughout the day, true?
Absolutely. It takes work, but you can do it.
And if it's somebody that's buttoned up like she is, you just work it into the schedule.
And that might be something that works for you, to actually scheduling time where you can enjoy yourself and focus on that self-care.
If you take a few times through the day, like every 2 or 3 hours, and you do some things that efficiently de-stress yourself, it's like, the cup fills up with stress, and you take even 5 minutes to empty that cup of stress. It will take hours to fill back up, and then you empty it again. Your efficiency, the efficiencies with which you discharge your responsibilities, do your work, will go up as much as 30 or 40%.
Now you're talking.
You talk about take control of your heart disease risk. And a big part of that is recognizing that your emotions and your stress do interact with your heart, even to the point of changing its anatomy.
That's right. And there is no physical health without mental health. And we don't focus enough on that. And what's happening with this chronic stress that you're having is it's causing these release of norepinephrine and epinephrine. And in the short term, that's good. But in the long term, it's clamping down on your blood vessels. It's increasing blood pressure. It's decreasing blood flow to the heart and vital organs. And that's what's causing those symptoms of chest pain and a heart attack that you're having. There's a physiologic reason why stress damages the heart. I bet if we measured something called C-reactive protein, which is a measure of chronic inflammation, I bet yours would be pretty high. And inflammation in the short term is good if you damage your foot, but long term, inflammation is going to damage your cells and actually increase plaque in your blood vessels, and that increases your heart disease risk.
Yeah, I was thinking about this a couple of nights ago, and this just came to me. I envisioned, your headstone. Here lies Emily. She wasn't lazy. You don't want that on your headstone. Or here lies Emily, too busy to rest in peace. Or here lies Emily, no time to live, but plenty of time to die. You don't want these on your headstone.
My dad would be really proud of the not lazy one, though, I think.
Yeah, he would be a lot more proud for you to come over and spend some time with him. Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.